All right, hi everyone. Thank you for taking some time to watch this video. My name is Emily Wells and I am the Northeast Regional Coordinator for a nonprofit organization called the Mental Health Association of East Tennessee. And what I do is I work up in the top 8 counties in Northeast Tennessee. I'm mainly based in the Tri-Cities, so Johnson City, Kingsport, and Bristol. And I go into middle and high schools and do a program called Mental Health 101, which you all may have had come to your school and maybe talk to your wellness class about mental health, mental illness, and coping with stress. And so we wanted to take some time to talk to you guys today about COVID-19.
And my name is Sarah Waldrop. I'm the Southeast Regional Coordinator. So I'm mostly located out of the Chattanooga area in Hamilton County, but similar to Emily, I do work in the 10 counties down here in the Southeast. Just like her, go into middle and high schools and do the mental health 101 program, as well as different community programs as well based around the need, which is why today we have created this video talking about COVID-19, since it's definitely what has been affecting all of us.
So what is COVID-19? This is something that's been in the news. It's affected our daily routines. So let's talk about it. So the coronavirus disease 2019, which is what COVID-19 stands for, is a respiratory illness that can spread from person to person, and it's a novel virus. So it is one that we've not seen before. And it's affected all of us in one way or another. Currently in the United States, there have been over 44,000 cases of this virus, and of these cases, there's been 544 deaths. Most symptoms are mild and treatable with over-the-counter medication, hydrating your body, and getting enough rest. But with multiple different sources of information, the media, and general panic that has kind of surrounded this outbreak, it's important for you and your family to understand the basic facts. So we're going to take a moment to watch this video, and this kind of breaks down how the coronavirus affects your body and explains how it's going to be affecting your immune system. It goes into detail about why we're taking so many steps to try to increase social distancing and decrease the spread of the disease. So let's take a few minutes to talk about this, and then we'll take some time to talk about how it affects you personally.
In December 2019, the Chinese authorities notified the world that a virus was spreading through their communities. In the following months, it spread to other countries, with cases doubling within days. This virus is the severe acute respiratory syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. What actually happens when it infects a human, and what should we all do? A virus is really just a hull around genetic material and a few proteins, arguably not even a living thing. It can only make more of itself by entering a living cell. Corona may spread via surfaces, but it's still uncertain how long it can survive on them. Its main way of spreading seems to be droplet infection, when people cough, or if you touch someone who's ill and then your face, say rubbing your eyes or nose. The virus starts its journey here and then hitches a ride as a stowaway deeper into the body. Its destinations are the intestines, the spleen, or the lungs, where it can have the most dramatic effect. Even just a few coronaviruses can cause quite a dramatic situation. The lungs are lined with billions of epithelial cells. These are the border cells of your body, lining your organs and mucosa, waiting to be infected. Corona connects to a specific receptor on its victim's membranes to inject its genetic material. The cell, ignorant of what's happening, executes the new instructions, which are pretty simple: copy and reassemble. It fills up with more and more copies of the original virus until it reaches a critical point and receives one final order: self-destruct. The cell sort of melts away, releasing new corona particles, ready to attack more cells. The number of infected cells grows exponentially. After about 10 days, millions of body cells are infected and billions of viruses swarm the lungs. The virus has not caused too much damage yet, but corona is now going to release a real beast on you, your own immune system. The immune system, while there to protect you, can actually be pretty dangerous to yourself and needs tight regulation. And as immune cells pour into the lungs to fight the virus, corona infects some of them and creates confusion. Cells have neither ears nor eyes. They communicate mostly via tiny information proteins called cytokines. Nearly every important immune reaction is controlled by them. Corona causes infected immune cells to overreact and yell bloody murder. In a sense, it puts the immune system into a fighting frenzy and sends way more soldiers than it should, wasting its resources and causing damage. Two kinds of cells in particular wreak havoc. First, neutrophils, which are great at killing stuff, including ourselves. As they arrive in their thousands, they start pumping out enzymes that destroy as many friends as enemies. The other important type of cells that go into a frenzy are killer T cells, which usually order infected cells to commit controlled suicide. Confused as they are, they start ordering healthy cells to kill themselves too. The more and more immune cells arrive, the more damage they do, and the more healthy lung tissue they kill. This might get so bad that it can cause permanent, irreversible damage that leads to lifelong disabilities. In most cases, the immune system slowly regains control. It kills the infected cells, intercepts the viruses trying to infect new ones, and cleans up the battlefield. Recovery begins. The majority of people infected by corona will get through it with relatively mild symptoms. But many cases become severe or even critical. We don't know the percentage because not all cases have been identified, but it's safe to say that there is a lot more than with the flu. In more severe cases, millions of epithelial cells have died, and with them, the lung's protective lining is gone. That means that the alveoli, tiny air sacs via which breathing occurs, can be infected by bacteria that aren't usually a big problem. Patients get pneumonia, respiration becomes hard or even fails, and patients need ventilators to survive. The immune system has fought at full capacity for weeks and made millions of antiviral weapons. And as thousands of bacteria rapidly multiply, it is overwhelmed. They enter the blood and overrun the body. If this happens, death is very likely. The coronavirus is often compared to the flu, but actually, it's much more dangerous. While the exact death rate is hard to pin down during an ongoing pandemic, we know for sure that it's much more contagious and spreads faster than the flu. There are two futures for a pandemic like corona: fast and slow. Which future we will see depends on how we all react to it in the early days of the outbreak. A fast pandemic will be horrible and cost many lives. A slow pandemic will not be remembered by the history books. The worst-case scenario for a fast pandemic begins with a very rapid rate of infection because there are no countermeasures in place to slow it down. Why is this so bad? In a fast pandemic, many people get sick at the same time. If the numbers get too large, healthcare systems become unable to handle it. There aren't enough resources like medical staff or equipment like ventilators left to help everybody. People will die untreated. And as more healthcare workers get sick themselves, the capacity of healthcare systems falls even further. If this becomes the case, then horrible decisions will have to be made about who gets to live and who doesn't. The number of deaths rises significantly in such a scenario. To avoid this, the world, that means all of us, needs to do what it can to turn this into a slow pandemic. A pandemic is slowed down by the right responses, especially in the early phase, so that everyone who gets sick can get treatment and there's no crunch point with overwhelmed hospitals. Since we don't have a vaccine for corona, we have to socially engineer our behavior to act like a social vaccine. This simply means two things: not getting infected and not infecting others. Although it sounds trivial, the very best thing you can do is to wash your hands. Soap is actually a powerful tool. The coronavirus is encased in what is basically a layer of fat. Soap breaks that fat apart and leaves it unable to infect you. It also makes your hands slippery, and with the mechanical motions of washing, viruses are ripped away. To do it properly, wash your hands as if you've just cut up some jalapenos and want to put in your contacts next. The next thing is social distancing, which is not a nice experience, but a nice thing to do. This means no hugging, no handshakes. If you can stay at home to protect those who need to be out for society to function, from doctors to cashiers or police officers. You depend on all of them. They all depend on you to not get sick. On a larger level, there are quarantines, which can mean different things, from travel restrictions or actual orders to stay at home. Quarantines are not great to experience and certainly not popular, but they buy us, and especially the researchers working on medication and vaccination, crucial time. So if you are put under quarantine, you should understand why and respect it. None of this is fun, but looking at the big picture, it is a really small price to pay. The question of how pandemics end depends on how they start. If they start fast with a steep slope, they end badly. If they start slow with a not so steep slope, they end okayish. And in this day and age, it really is in all of our hands, literally and figuratively. A huge thanks to the experts who helped us on short notice with this video, especially Our World in Data.
So after watching that video, we definitely have a better idea of what the coronavirus has done to our bodies and how it is transmitted to other people. But there are a few key facts I want to point out to everyone that we prioritize to keep in mind and fully understand, okay? So the first one, and fact number one, is that diseases can make anyone sick regardless of their race or ethnicity. The coronavirus has affected people from many different countries, and now it has spread to all corners of the earth. So we want to make sure we don't attach it to any ethnicity or nationality. In any country, we want to make sure we're being empathetic to those that have been affected by the coronavirus, which is pretty much everyone nowadays. So those with the disease have not done anything wrong, and the fear and anxiety about coronavirus can cause people to avoid or reject others, even though they are not at risk for spreading the virus due to their race or their ethnicity. So it's super important because we don't want to increase or contribute to any stigma or racism due to our own lack of understanding that the disease can actually affect anyone. Fact number two is that for most people, the immediate risk of becoming seriously ill from the virus that causes COVID-19 is very, very low. So while anyone can get coronavirus, those with immunodeficiencies are at a much higher risk. And that includes older adults or people that have lung or heart disease. Some people have diabetes, cancer, or lupus. People that live with these will have the more severe symptoms of illness, and it's very important we prevent ourselves from spreading to these groups. And fact number three is that someone who has completed quarantine or has been released from isolation does not pose a risk of infection to others. So making sure that we understand that individuals who have coronavirus and have completed treatment and quarantine are actually no longer a risk to anyone else. So make sure that we don't refer to people with the disease as cases, victims, labeling them as an entire family or as a diseased person, but instead they are people who have COVID-19, people who are being treated for coronavirus, people who are recovering, and after recovering, understand that their life will go on with their jobs, their families and loved ones as it was previously. So, with all the school closings and having to stay home with your parents, we have sports canceling their final games, prom, other fun events being postponed. This has become an entirely new change of routine. Our entire day-to-day life that we might have been happy with or gotten used to before has been turned upside down and uprooted. And with this, we definitely recognize that it can cause your stress levels to be higher, and you may feel some emotions you haven't experienced before. And since it's a situation many of us have never been through, it's perfectly normal for someone to have reactions that are new and possibly confusing. And the great news about this is that there's actually no right way for you to be feeling right now. So it definitely takes that pressure off you to feel like you have to fit into some kind of mold, because this is a new situation for everyone. So while you may see your parents panic, or you could feel panicked yourself, that's perfectly normal and it's okay. There's going to be feelings of being overwhelmed. You could be sad or angry. There's definitely a lot of feelings of worry, of feeling out of control. Lots of people are feeling frustrated with the situation at hand. A lot of us are getting bored sitting at home, right? But some people might even feel excited about not having to go to school or relieved from getting out of some situations that previously in. So all of those feelings and more are perfectly valid and okay to have during this time. And so it's very important to remember that we want to learn how to manage those new emotions and the feelings of stress you may have. But before we learn on how to manage those emotions, I want us to talk about how all this new stress and emotions can actually affect your physical health.
So a lot of us may feel stressed from the changes that we are experiencing and the news that we are hearing. We may feel stressed about not knowing exactly what will happen next. And stress can have an effect both on our mental and physical health, especially if we do not deal with the stress that we are experiencing in a healthy way. So chronic stress or long-term stress can cause us to have headaches and anxiety. We might be more irritable and overreact to small situations that might not normally bother us. And we might even have trouble concentrating. And physically, we could have digestive problems. So a lot of people have an upset stomach when they're really stressed out. We could be more likely to get sick because our immune system is actually compromised when we are super stressed. We could see changes in our eating or sleeping habits. So maybe we are eating tons of junk food to try to soothe ourselves, or maybe we find it hard to eat anything at all because we're upset and stressed out. Maybe for our sleeping habits, we just want to sleep all the time to try to forget about our worries, or maybe we can't sleep at all because our minds are racing and thinking about all the things that are stressing us out. So everyone can have different responses to stress. And now is an extremely important time to reflect and recognize how you personally might be reacting to the stress you're under so that you can equip yourself with positive ways to cope. Stress during an infectious disease outbreak could include fear or worry about your own health or the health of your loved ones. A lot of us may be worrying about the older people we have in our lives, like our grandparents. We also might have a worsening of our own health problems. So especially if we have a mental illness during this time, and being out of our routine could cause us to have that be a little bit more extreme or exasperated. We might even have an increased use of substances. So if we're turning to substances like vaping, smoking, or drinking to try to cover up the stress that we are feeling, that's an unhealthy way to cope. So let's talk about some positive ways that we could be coping with this.
So since we just talked about all the ways that stress can negatively affect our bodies, we want to make sure that we recognize it's important to use self-care and positive coping mechanisms during this time for ourselves. So there are a few that I want to go over with you that would be great for you to implement in your daily lives. So the first one is to make sure you're connecting with others, okay? Because even though we are in these situations feeling like we're isolated and we have a very limited social, physical contact with people, which is to contain the outbreak, you can stay connected with your family and friends through social media, video conferencing, calling them on the phone, using FaceTime, even emailing people. So make sure that you are talking with the people you trust about any concerns you have and how you are feeling during this time. Secondly, we're going to talk about taking a break from screen time. So as you know, there's a near constant stream of news reports, and any kind of constant streaming can make anyone feel anxious or distressed. So make sure you seek information, updates, and practical guidance at specific times during the day from health professionals, and avoid listening to or following rumors that make you feel uncomfortable. So take a break from watching, reading, or listening to news stories. And this does include on our social media. As you know, on Facebook, Instagram, people are constantly posting things, but hearing about it repeatedly can actually be very upsetting. So in order to practice this, we need to make sure we're limiting the frequency of our updates. There are things rapidly changing, numbers changing every day, but that doesn't mean you have to hang on to every single update. Next, we really need to practice our social media self-discipline. It's not going to be easy to limit your time on social media, especially because we are trying to stay connected with others. But the chances are that the amount of information and comments that you get from your friends on Facebook or Instagram is a lot more frequent than the actual updates from the news or health organizations themselves. So if that means having to uninstall social media apps so it's harder to get that content, or using tools like a timer to limit the amount of scrolling that you're doing, try to put those into practice so you can take a break. We also really need to understand that we have to know when to walk away. So making sure that we're actually getting off our phones, sometimes that can help us just not check it. So if that means leaving it in another room, leaving it on the charging station, making sure it's not constantly with you will help you limit that screen time. Next, we're going to talk about the importance of keeping a routine. Since so much of our typical routine has been uprooted, it's important to try and set a new one, even during this time. We don't know how long it's going to last for, but it can be something as simple as getting up at the same time every day and making your bed each morning. And a consistent routine can help us feel more in control and alleviate some of the stress that we might feel because of the unknown. Lastly, make sure that we're taking care of ourselves and practicing self-care. So that includes your physical and your mental health. So going for a walk outside or jog around your block to get endorphins running and some fresh air. You could try to meditate or practice yoga. Deep breathing techniques will help alleviate feelings of nervousness and anxiety. And during times of stress, just making sure we're prioritizing our own needs and feelings and engaging in healthy activities that we find relaxing and enjoyable for ourselves. So just really stressing here the importance of exercising regularly, keeping regular sleep routines, and eating healthy foods.
Sarah talked about both about self-care and keeping a routine. A lot of times a mindfulness exercise can really assist us in that. And it's a great way to help ourselves de-stress by taking a few minutes to meditate, focus on our breathing, and centering our mind and body. And a lot of times that might sound silly or unnecessary to you, but you should give it a try, because with everything that has happened over the past week or so, our world could feel chaotic and fast. And it might even seem scary in some ways. So it's important to take some time each day to just be still and clear our minds. We will provide the link for this exact video in the description, and there will be a few more that you all can choose from. So now is a perfect time to really kind of be a student of yourself, or in other words, learn what makes yourself feel grounded, safe, and mindful, and kind of reflect on what can best help you during this stressful time. In addition to the mindfulness exercises, you could also consider taking a screening. And there are several reasons why the coronavirus could trigger mental health issues. You may feel fear for the health of your loved ones, like your parents or grandparents. You may miss spending time with friends and feel lonely being stuck at home. I know a lot of people who are usually super social might feel isolated. You may have anxiety about even getting sick yourself, and all of these are valid thoughts and concerns. And if you have tried using positive coping mechanisms like the ones that we have discussed and you're still struggling, taking a few minutes to take a free screening could help you learn more about what you're going through and maybe give you some resources on how to get help. So there are screenings on anxiety, depression, and more that you can find online. People with pre-existing mental health conditions should continue with the treatment that they were already on and be aware of new or worsening symptoms. And talk to your parents or call your health provider if your stress is getting in the way of your everyday activities. So many providers are even offering telemedicine, which is basically virtual medical care. So either over the phone or through a video chat. So there's tons of options for ways that you can get help if you need it.
And there are simple things that you can do to keep yourself and others healthy every single day. And I know that you've heard of a lot of these already, but we do just want to highlight on a couple of them again. The importance of washing your hands frequently with soap and water. This is especially important if you've been blowing your nose or coughing or sneezing. It is allergy season, you guys, so making sure that even if it's just seasonal allergies, we're still putting this practice into our daily lives. Making sure that we're avoiding touching our eyes, nose, and our mouth, especially if you have been out in a public place and you haven't gotten the chance to wash your hands. It's super, super important for us to stay home if you are feeling sick and to call your doctor before you go in. And so if you are feeling sick, make sure that you're covering your cough and your sneeze with a tissue or even into your elbow if you don't have access to any tissues right now. And of course, we can help stop the spread of coronavirus by knowing the signs and symptoms ourselves and understanding when we do need to go to the doctor or call our doctor. So the 3 symptoms that are very important to acknowledge are fever, cough, and shortness of breath. So if you do develop those symptoms and you have been in contact with a person known to have coronavirus or live in an area with an ongoing spread, make sure you call ahead to your doctor's office or the emergency room and tell them what you're experiencing, your recent travel, who you've been in contact with, as well as your symptoms. And lastly, it's very important for us as members of the community to find sources that you trust and to stick with those. So choose one national source like the CDC and another local source like your local health department so that you can know what's going on in your community specifically. And this will help us keep things in perspective because ultimately the public health agencies and experts in all countries around the world are working on an outbreak to ensure the availability of the best care to those affected, whether that be a vaccine or tests. And so keeping that in perspective, finding those true sources so that we're not feeding into or believing any of the rumors or the unreliable sources that are out there.
So hopefully you all feel better informed on what the coronavirus is and how you can help decrease the spread of the virus, and also how you can help yourself with the stress and emotions you may be feeling from what you are experiencing. There is still uncertainty surrounding the next few weeks and what they may hold and what may change or stay the same. So keep talking about it with your friends and family. Try to have open conversations each day about how you're feeling, maybe about what the news may be saying or what you've seen online, and what you need to do to keep yourself mentally and physically healthy during this time. So our emotions can change from day to day or from hour to hour, and being in tune with yourself and knowing what you can do to help yourself is extremely important. So another thing we can do is find opportunities to amplify positive stories and positive images of local people, maybe who've experienced the new coronavirus and have recovered, or who have supported a loved one through the recovery. Because a lot of times we see a lot of negativity and we hear a lot of scary stories about people suffering from this illness. But if we can find some positive stories and focus on those as well, it'll help put things in perspective and give us some balance. So keep hopeful and use positive thinking to try to reset your mind in times of stress, fear, or anger. And we'll make it through this together. So don't give up hope and keep your conversation going.
And for anyone who is interested in finding those sources that you can trust in doing your own research about the coronavirus, there are some very helpful websites that we used for this presentation and that we have used for personal research as well, that we will have posted below in the description of the video. So you're more than welcome to do research on your own by visiting these websites, but make sure, like we said, if you are feeling overwhelmed, know when to stop reading about the virus and just give yourself a break from it. We have numerous other resources listed below these, and we just thought they would be helpful. So some of them are videos, some of them are TED Talks. So just take the time to figure out what works best for you during this time. Do research if you need, but also make sure that you're practicing your self-care and staying fully educated on what's going on around you.
So to wrap up, what's most important is to try to stay positive and really focus on what you can control during this time. So a lot of people feel stressed because they feel like so many things are out of their control, but there's several things like your own routine and your own self-care that you have full control over. And you could use this time to do a few fun things. So maybe consider starting a new hobby, doing a craft at home, and catching up with a friend you haven't spoken to in a while. So calling people, FaceTiming or video calling, texting, whatever you prefer. And read a good book. So a lot of us might not read very often. Maybe we were too stressed out with school or other things going on, and now we have time where we could pick up a good book and read it. And you could even treat yourself. So watch a new show on Netflix or cook a dessert or whatever you found that makes you happy and makes you feel less stressed. That's great to turn to during this time. So use it for something positive and try to make the best of it. And thank you so much for listening. So we do want to take a few moments to acknowledge United Healthcare Community Plan and the Tennessee Department of Mental Health and Substance Abuse Services, who both support the Mental Health Association of East Tennessee through grant funding. So presentations like this one and the classroom guide that we created and all of our community outreach efforts would not be possible without their continued support. We also want to state that the video that was shown during this presentation, titled "The Coronavirus Explained and What You Should Do," was created and published on YouTube by an agency called Kurzgesagt. They are one of the biggest science channels on YouTube, and we have included a link to their channel and their website in the description below. The Mental Health Association of East Tennessee does not have any ownership or rights to that video that was shown, but we thought it did an excellent job of explaining the current outbreak. So thank you again so much for listening. Please try to stay safe and healthy, both physically and mentally during this time. Continue to strive to keep physical distance, but social connection through virtual means or by being with your family. And we will get through this together, so stay hopeful. Thank you so much.